Patty Ingram, who I assume you all know very well, had contacted me maybe a month ago. She was telling me about this little gardening club that she had. She went to, and then she had to bow out for personal reasons as far as being here. And then, so Deborah became my contact. Deborah's not here either, so I don't believe it. But anyway, what a wonderful group that you have here. Way more than I expected. That's okay. That's more people to talk to, maybe more people to reach. So, a little bit about me, a little bit about what we do, and then we're going to all be about you. What we can do here today to help you have the best gardening season ever from a physical view. Who wants to have the best physical gardening season ever? Like 5 people? Okay, so my name is Dr. Mike Carter. I am a chiropractor in Oklahoma City. Been practicing for over 23 years. Born and raised in Oklahoma, up by the Panhandle. How many of you know where Buffalo, Oklahoma is? Yeah, so you usually see it for the coldest, the hottest, the most snow, and the driest, of course. So I've been doing this for over 23 years. We're very unique in what we do because we take a functional approach. We are all about helping people's bodies use the best that they can. So we offer multiple services because people have multiple different problems and need different kinds of care. So everything is specialized for each and every individual person. We have massage therapy, we do physical therapies, we do what we call functional rehabilitation, and we do fun, cool, new things like cold laser that helps the body to heal faster. We do spine, hip, and knee decompression. So for people in the spine with herniated or bulging discs, this is what saves them from surgery if that's possible in their case. And it is part of protocols for knee restoration programs for those people where your doctor says, and hip too, by the way, where your doctor says, well, it's not time for surgery yet. You'll know when. Our job is to make your life as good as it possibly can and extend that when as long as possible. We also have trans technology that is called Sanuwave. It is a tissue regeneration device. It's the only one in the state of Oklahoma. It is fantastic. If you've ever researched stem cell therapy, think of stem cell therapy without the shots, without the recovery period, and without the price tag. So it works very, very well. We get to see people walk in our office in tears and walk out. In fact, was that last week? Last week, we had an 88-year-old woman come in with a walker, 10 out of 10 pain, miserable, couldn't sit still. She was referred by a neurosurgeon. And she walked in yesterday without one. So it's pretty cool. And it's thanks to this machine here. So that's a little bit about us. Definitely unique in the Metroplex of the state as far as how we approach and the protocols that we use to help people. So there, got that out of the way. Now it's all about you. So I've been doing this long enough. In fact, Melissa's back here recording. She's my wife, my right hand at home, and the actually I'm her right hand at home. So I was just talking about this here on the way, and I've said this for years and years and years. Gardening season is like Black Friday. Okay? Because just like, and I'm sorry, I did not catch the gentleman's name. Bill was up here saying a minute ago. He just said something extremely important, stole a little bit of my thunder, but also helped introduce us to exactly what we're going to talk about. And he said, going in cold. And he's 100% right. I will tell you that every year from about mid-March, ramping up in April, and then kind of peaking in May, is when I get new and current and past patients who come in because they've hurt themselves from the simple act of gardening. Right? So make sure I'm talking to who I think I'm talking to here. Don't be bashful. How many of you have ever started a gardening season and then paid for it with some sort of back pain or something? Let me see a show of hands. Okay, so very good. That's definitely in the right room. Glad to be here. So let's talk about what we're going to do to help help you prevent that. And I'm gonna look at my handy dandy cheat card. My cheat card is to make sure that I don't talk too long, okay? So let's talk about alignment and how that's important with your lives. Everybody drove here or rode here in some kind of mechanical machine, car, pickup, van, something, right? Okay. We've been around those all of our lives. Would you say that it is acceptable and common knowledge to realize that many of those mechanical parts in the automobile that you drove or rode here in today have an acceptable life expectancy? You guys all agree? Absolutely. A very common wearable part, replaceable part, in fact, it's not even covered on any warranty that I know of with a new car, is your tires. Right? Tires pretty important, right? Don't want to have a blowout going down I-40 down here at 80 miles an hour. You don't want to get stuck in the ice and snow because you've lost your traction. Those tires are extremely important to the overall function of your car and getting you safely from A to B. Extremely important, right? Now the sad thing about it here, there's a good number of people in here, unfortunately, that are guilty of taking better care of their car that they're going to trade an average of every 3 years than they are of their spine, which is the one and only one you will ever have. So I want you to think about your spine and other joints of the body as having wearable mechanical parts. Because it's true, that's the way it works. Some of you out here might have had a knee replacement. Some of you out here might have had a hip replacement. And I can tell you, whenever I was 13 or 14 years old back on the farm, my granddad told me he was having a knee replacement. And I said, well, why are you having a knee replacement? And he said, oh, it's just old and worn out. And I said, well, when do you get the other one replaced? And he said, no, it's fine. I said, aren't they the same age? Right? So we kind of have a weird way of thinking in our society now that wearing out is normal. The doctor says, that's normal arthritis for your age. That's normal aging for you. It's normal to have a hip replacement or whatever. They're actually using the wrong word. The word is actually common. No. Just like if you were to take your car and you go spend $1,000, $2,000 on new tires, and you go take it right into good alignment because you want those tires to last that 50, 60, 70,000 miles you were promised, right? Absolutely. But if you're driving along out here, because Oklahoma roads are so wonderful, right? And you hit one of these giant potholes that jars your teeth, and it knocks the car out of alignment, the front end out of alignment. Now, if it's bad enough, it's shaking you around enough that it becomes a high enough priority that you take it in to get it fixed right away, right? But that's not often the case. Often the case is there's going to be a misalignment. But we forget about it, right? We get busy. We got gardening meetings to go to, right? We got grandkids to see. We have work to go to. A number of different things that become very important, and we forget about it. Until you're ready to drive to Florida or Colorado Mountains or whatever to go on vacation, and you walk out there and you think, what is that metal showing on my tire? Right? Shouldn't be there. These are your tires. Why is that metal there? That metal is there because the tires have had abnormal stress on them in areas they were never designed to have that kind of stress. Fair enough? Okay. The spine is the exact same way. So I'm going to go over a quick model here. Oh, and by the way, since I did forget to tell you guys this, I know I'm standing up here just talking at you now, but we're going to be interactive and you guys will get to stand up and move around, so that'll be really good. We're going to do an activity here in a minute, but it's very important to understand, no, this is not real. So if you were to look at the spine, would everybody agree that being straight up and down is way better than being crooked? Absolutely. Well, here's what people do not realize is that from the side, you want to look like you're straight up and down with your ear directly over your shoulder, which we'll talk about here in a minute. But that spine is definitely not straight, is it? Yeah. There are specific critical curves that oppose each other in the spine, that keep the head above the pelvis. And that is like the proper alignment of the front end of your car for those new tires. This is what helps the joints of the spine to last as long as they can. You guys had a prayer earlier, so can anybody tell me what the Bible says is our life expectancy for biblical terms? 120 years. When's the last person we've seen anywhere close to 120 years, right? Okay, so that's God's plan for us, right? But we mess it up due to a number of different things: slips, falls, poor posture, poor sleeping habits, car wrecks, you name it. There's a lot of different issues. One of the biggest ones from the side, we got grandkids in here. What are grandkids glued to? Their TV or their phones or tablets, right? Do they hold them up here nice and neatly? Great posture. Or do they sit here like this? Yeah, exactly right. I'm telling you that what we treat in our office with our functional rehabilitation, there's an epidemic coming that we can't handle as an entire profession because of the devices. Okay, now, quick check. Very good. So does everybody get that arthritis is not normal? It's really important. It's really important. And one of the saddest things, when people hear arthritis, it's really sad because it's like they just accept it. Well, that's, I'm that age. And they start giving things up, like gardening. They give up golf. They have to hire people to clean their house. Whatever it is, I've heard it all. So what we're going to talk about here real quickly is posture, right? So posture, we like to say, is a window into the spine. If you can see somebody's posture is off, then we know if we were to go take x-rays, it's going to be off on the inside as well, right? And that off equates to the off of the alignment in front of your car, which causes accelerated aging, which leads to arthritis, degenerative disc disease, bulging disc, herniated disc, and so forth. Okay? Now, I told you we're going to be interactive here. Would somebody like to be a volunteer for me to go over how to look at posture? I know the names of two people. Oh, good. The two people I know the names of here just got lucky. Come on up here. Thank you. Yeah, just got lucky. Leslie, thank you very much. So Leslie, I'm going to have you stand right here. Is Leslie the life of the party? Yeah? Okay. Okay, very good. So, one thing you want to realize is that we are all good at faking things and hiding things. We're really good at minimizing what our problems are. It's human nature, we do it, right? We got things going on. Our body is really good at covering up for us too. And to take this to the extreme, just because I've had some experience with this, if you know somebody who ever starts into having memory problems in their early Alzheimer's stuff, you know they're very good at faking. Human nature, we're all good. Okay? Leslie. So, let me lay your arms on your side. So what we're going to do is we're going to take away her ability to fake it here. Okay? She's probably been going to chiropractor like every day for 30 years and has perfect posture. She's the worst person to bring up. Okay, so what we're going to have here, and pay attention because we're going to pair up here in a minute, we're going to check each other's posture out, okay? Extremely important. So what we're going to have Leslie do here, she's going to look straight ahead. She's going to close her eyes and keep her eyes closed until I tell her to open, okay? We're going to have her with her eyes closed, raise her head up to the ceiling, where she can go.
My head?
Head. Yeah, keep my head. Don't just nod up to the ceiling as far as you can. Yeah, perfect. Now nod up to the floor as far as you can. Now bring it back to the center. And then with your eyes closed, turn to the right as far as you can go, and the left as far as you can go, back to the center, eyes closed the whole time. Outstanding. Okay, so we're going to look, you can either look from the top down or the bottom up, but just pick one and go with it, right? So, if we look at Leslie right here, I told you we're all cheaters. I'm going to pull back here so you can see her ears. I got scissors over here. Rather have her.
No.
Okay, very good. Okay, so straight ahead here. So we're going to want to look, first of all, I'm going to step back here, maybe that's a little bit. We're going to want to look right here at, the first thing we're going to look at is your head, and we're going to work our way down. Does anybody in here see a tilt of her head? Yes. Yes, thank you. Very good. It's tilted to the right. Now, if we look at her shoulders, which one's higher?
Right, the right one.
Okay. Well, I was the left. Let's see. Yeah, left for sure. Would you all agree? Left?
Left is higher?
Yep, okay. Now, if I can check waistline here, is it okay? Very good. So now we're gonna look at our hips. I can't see, but I can feel. What do we see? Anybody? Can you see my hands? Well, I'm gonna say left side, just from looking at the back, okay? So that's how we're gonna address from the front to back. And that's 3 issues that we saw already, right? Okay, any questions on that? Everybody understand what we're looking for? Very good. You wanna turn right or left? There you go, very good.
Keeping my eyes shut?
Yep, keeping your eyes shut. Go ahead and nod your head up and down and then back straight ahead again and keep your eyes closed the whole time. Okay, very good. Now, think about a soldier standing at attention, 19-year-old soldier or whatever. No, you gotta stand like you normally do. So we should see the center of the ear, over the center of the shoulder, over the center of the hip, over the center of the knee, over the center of the ankle in a straight line, standing in normal, natural posture. Okay? So, if we look, there's the center of her shoulder, so she's a little bit forward, not a lot. And then we're going to go down to the hip, and we're going to see we're backwards, correct? And then we'll see the knee. I'd say she might not have a lot of neck pain, but back pain could be a different story. Yep. Okay, very good. Medical terms from a functional point of view, we call that lower cross syndrome. So anytime you have a cross syndrome, that means you have muscles that are too tight in one area, pulling the spine out of alignment. They shorten over time. And then you have the muscles that are supposed to be holding the spine in alignment that are weak because they've given up. Because this, you will, your eyes stay just like that. Yeah, stay just like that. One more thing for you here, okay? Anyway, okay, so we're going to do one more example here, and then we're going to pair off, and then we're going to show you something right here. So, everybody's been doing their physics homework, right? Everybody's up and real sharp on biomechanics, so you'll understand exactly what we're going to talk about here, right? Actually, we're going to make it very simple. You all know this, you just don't know that you know this. This is a 6-pound lead ball. If you're a fisherman, this is a downrigger ball. Okay, 6 pound, about the weight of a girl's shot put. Now, the average head is going to weigh about 10 to 15 pounds, and I will tell you it's closer to 15 than 10 most times. And with the proper alignment of the spine, so remember the spine from the side, you saw the different curves in the spine with the head over the shoulder, over the pelvis, right? We're going to set Leslie up for this right here. So if you go ahead and face this way, your wrist pose.
I can tell.
Okay, all right. Let's take your left hand and I want you to hold it right like this. Okay? This is a 6-pound ball. Now, if we're looking from the side, this is her pelvis, this is the rest of her spine, this is her neck. That's normal. Now, we're going to learn how to check each other's posture. We're going to do it actually here. Maybe you've already learned how to do it. But think about the people that you see, whether it's grandkids, people in public. It could be yourself, your spouse, a good friend, with the head forward like this. I'm going to show you what this does, because when the head goes forward, hold on really tight.
Yeah, it's heavy.
When the head goes forward, the person loses the curve. Hold just like that.
You can test me.
You got it? Yeah. What happened?
I'm using I'm using other muscles.
Right. Did the weight feel like it changed?
Oh, yeah.
Absolutely, big time. Absolutely, very good. Yeah, so what that does is that changes the effective weight. It's like throwing the front end of your car out of alignment. It puts stresses on the spine in places that it was never designed to have that stress, and then it wears that out faster. And when you go to the doctor, they say that's normal for your age. No more normal than your tires wearing off on the outside down to the cords. Okay? Now, for you helping us, if it's okay with you, we're going to do a digital posture evaluation and see what we see. Does that sound good?
That's fine.
Okay. I think Melissa's got it all set up here for me. This is something we do in our office. We actually do a really thorough evaluation from a functional point of view. Okay, so any chance I can get you to all of you? Perfect. I feel like a magician today. My assistant. Okay, so we're going to have our arms to our side. I want you to pull your hair back behind your ears. Very, very good. We're going to have you close your eyes, nod up and down and straight ahead real quick. Okay, come back to center, eyes closed. This thing and we're turned left, correct? Melissa, you
Yes.
said this. Perfect. So just like that. Okay. Yeah, you can open your eyes. We just put a random link in there. You don't.
I can tell you
don't
what it
mind
is, I don't.
you don't mind 300 pounds.
No, that won't work.
Okay, so we put a random, it didn't matter if somebody came up here as 100 pounds or 300 pounds, we just put 170 pounds in there just so you guys don't sit here and wait on this, okay? So what we've done right here is we've done a posture analysis, and I'm happy to pass this around if you want to see it. Let's see here. Go. Let's go back to here.
That's a terrible picture.
Well, you know, just pretend you get your driver's license. Okay, so based off of this, with Leslie here, we're saying based off of a 170-pound person, that their head would weigh 13 pounds. It's shifted how far forward?
2.34 inch.
2.34 inches, which makes the effective weight of her head alone
42.9 pounds. I got a big brain.
Absolutely. Yes, very good. Thank you very much. I appreciate that. Okay, so yeah, thank you very much. She was very good assistant. That's really good. So if you think about biomechanics, proper biomechanics and improper, and you heard me say, when Leslie was up here, we were doing the posture ourselves, just visual posture. You heard me say that her head wasn't that forward, that bad. Well, I said that because I'm used to seeing so much worse. So we saw almost tripling of the weight of her head. Basically the weight of carrying a 40-pound sack of dog food around on your head. Now, who thinks that that might lead to some neck pain, headaches, low back pain? Could even lead to shooting pain down the arms, headaches, and so forth. I mean, there's always a cause for everything, would you agree? And I haven't found yet where it's a lack of medication or a lack of surgery in our body. There's typically a physical cause. So let's pair up just as close as you can. We'll do some posture evaluations. Just take a couple minutes, and if you guys want to move around, get comfortable, that's fine. We'll just take about 5 minutes or less to do this. If you'll pair up and pick A and B, do that real quick. Not everybody all at once. You will have to stand to do this. It's okay. Just keep recording. Okay, all my A's, raise your hand. All my A's, raise your hand. Good. You guys do know the alphabet, right? Okay, very good. A's got their hands up. So, A, you're going to evaluate posture first. Now, I want you guys to pay attention. I'll ask a couple of you to share things. B, you're going to be the dummy, okay? They're going to evaluate your posture first. So, let's go straight on, face to face, and let's go from the top down. B's, I want you to close your eyes. Nod your head up and down and side to side. Bring it back to the center. Keep your eyes closed the whole time. Okay, very good. So B should be eyes closed, coming back to center. So let's, A's, we're going to take a look at the B's. We're going to take a look from the head down. If you can see their ears, that's helpful. And see if there's any kind of tilt, or there can even be a shift of the head from side to side.
What do you do if their ears are not even?
Sure. You can pick a different part, like maybe pick the center of the ear. Yeah. Pick something that is even. Okay, then come down to the shoulders. To the shoulders. Very good. And it felt. baseline, it's where the bone is right here. Right? We're doing massages on each other next. Okay, is everybody finished with your meeting? If you're finished with this? Okay, so now we're going to turn sideways to where A is looking at B from the side. Once again, close your eyes, hold your head up and down a couple times, back to zero, eyes closed. And if you have longer hair, go ahead and put it behind your ears. For the ear, we're looking at this little pointy part here. This little pointy part here. You want to see it directly over the point, the bony point of the shoulder. You want to see the bony point of the shoulder over the bony point of the hip. You want to see the hip over the center of the knee. And you want to see the center of the knee over the bump on the outside of your ankle. Yep, so we'll go Okay, so we'll do the next one quicker because now you're all experts. So we're going to switch. Now B is going to check out A's posture. Step back. need your help, right? So Andrea talked about social media. Now some of you might like social media, some of you might hate it, some of you might know anything about it. And she made some very good points. It's a very good way of sharing who you are, who we are, how you help people, how we help people, right? So if you think about like small businesses, you want to support your local small business, to make sure that your community is strong and so forth. So what I would like everybody to do, and I'm going to do this with you as well, is take out your phones if you've got smartphones, right? You're just done. Okay, so very good. So everybody take a picture of yourselves. Everybody smile, wave, whatever you want to do. Very good. See if we can get everybody. I can't see the button, so I'm just guessing, right? Okay, let's see if we got any there. Oh, and I was hitting the wrong button the whole time, of course. All right, here we go. Everybody wave and smile. Good. Now we'll see if we actually got any there. Yeah, I got a couple. Very good. So, how many of you guys in here are on any kind of social media, any way, shape, or form? Very good. Out of those, how many is on something different than Facebook? Okay, very good, very good. So what I would like for you to do, if you look up our Facebook page, it's Family Tree Chiropractic. We are very active in social media, and we are very active in social media for you. Because we put all kinds of new information out there, different stretching, different foods, anti-inflammation, things that you can do at home to help yourself. So if you would, do me a favor and pull up your Facebook and do a just quick search for Family Tree Chiropractic. And I realized when I got here that the Wi-Fi is almost necessary for this. You're going to see the blue. You'll see me up here wrestling with a patient. Okay. Very good. Now, if you would like free information, you can click on there where it says follow, and you can follow there. Right? Yeah. Awesome, awesome, awesome. Nope. It should be blue. It should have a blue tree. That's you. And then, do me a favor, if you'll go on to your own Facebook page, like you're going to post a picture of the grandkids or something like that, and if you'll take the photo that you took there and just post it, and you say, I'm at the Master Gardening Club today, learning from Dr. Michael Carter, and you can tag our business there on how to have a pain-free gardening season. I'll give you a couple, maybe a minute to do that. That'll be great. And then when you're finished with that, if you would go ahead and just have a seat, and we'll know when we're ready. We're getting ready to get to nitty-gritty. Yes, when you're finished now, you can sit. So did everybody get into the social media part? So if you the latest and greatest on Netflix, right? So we're sitting a bunch. We're still in a bad habit of eating like it's Thanksgiving or Christmas, right? So we have lack of activity, lack of vitamin D. As we sit more and more and more, those postural alterations cause the muscles to shorten more and weaken more. Everybody buy that? Is that fair enough? Okay. So right now, today is what, February 3rd? Today is when you start preparing to have your paint spring gardening season. If you wait and you forget and you just jump right into gardening, you run numbers 405, 3404, 400, right? You call me, it will help. But this is what you do to prevent that. Okay? Starting today, you can get it on our website, on our YouTube. That's what the social media forum is around. I can leave some more here if you like. There's one in front. You want to start doing daily stretches. And this is going to take 15 to 30 minutes each day. Now, if you already know you have back problems, and maybe you've been to a chiropractor or a physical therapist who's already told you what to do, and has already given you stretches to do, that you don't even know where they are, right? Okay? That means you need to do this twice a day. So the once a day is for the people who are otherwise healthy, not really having any problem, and we're just going to prepare. Okay? Like I said, I was kind of expecting a smaller group, so I was actually going to get somebody as a volunteer to do some stretching. You will have to get on the phone and get okay?
I'm fine.
All right, perfect.
I may be ancient, but I'm still.
No, I just.
Well, thank you.
Okay, very good. So let's talk about what stretching is, all right? And what stretching is not. When we're going to go stretch on these muscles, you want to have the muscles a little bit warm first. So if you have a vibration platform at the house you can be on for 10 minutes, that's great. If you can go for a 5-minute walk, or you just got finished doing any kind of activity, you see the blood flow, then we're going to start stretching. Proper form and proper breathing and stretching is key. One of the things that I have to correct people with all the time is when they stretch, they bounce. Fastest way to tighten your muscles. So what we're going to do is focus on stretching being a relaxation movement, okay? So what Carol is going to do here first is she's going to raise her left arm up as high as she can, nice and straight. She is going to gently relax to the right side with her right arm falling down. Notice she needs to let her head relax as well and lean to the right. Very good. Now, she is about as far as she can move now. Would you agree?
Yes.
Okay. Very important. Remember I said breathing is important? You guys watch and tell me what you see. Carol, take a deep breath into your nose. And then blow it out slowly through your mouth. You guys can all see her moving more. Let's do one more. And then out. Good. And let's do one more. And then out. Good. Now, if we stretch one side, we better stretch the other side, right? So let's reverse that, please. And we're going to lean the head too. We're going to breathe in through the nose. And out through the mouth. Relax. We're going to do 3 to 5 breaths, 3 to 5 times a day if you're having these tight muscles, but very minimum is once a day. Okay. Very good. All right, let's come back to the center. This one, some of you might have to be very careful with because we're going to do some gentle rotation. So the way that we're going to do this, I dream of genie arms, by the way. That's when I first learned I was old. When I told some 20-something to take an x-ray to give me right dream of genie arms, and she says, I don't know. So now we're going to get rotation in the entire spine. So Carolyn is going to turn her head to the right as far as she can go, and she's going to tilt her pelvis or twist her pelvis the other way. Take a deep breath in through the nose, out to the mouth, and she's going to lean into it, in the nose, out to the mouth. We're doing this a little bit quicker here, just for time's sake, because I don't want to run out of time. And then go to the other way and do that real quick. Don't ever push through pain with stretching. Stretching pain and joint pain are two totally different things. With me?
Okay, so if it hurts, then he's off a little bit?
Yeah. Now, the stretching hurts a little bit, right?
Right.
If you're feeling that locked up in the joint, yeah, it's time to back off because there's
Okay.
something, because that locking of that joint is going to prevent you from getting emotional when you can stretch the muscle. Yep. Okay. Very good. So there's a couple little things you can also do. You're bending forward to stretch out your hamstrings. So keep in mind in here we want to start out bending with our low back and not our hips. So Carol, we're gonna have you go ahead and bend forward like so. John, take a deep breath in through the nose and out through the mouth. Let your head hang heavy. Good. And you can do this on the floor too. Good. Very good. And then we're gonna come back to center, and she's gonna put her thumbs right back here on those knots. Those are called your sacroiliac joints. And she's gonna take a deep breath in through the nose. She's gonna blow out through her mouth. Relax. So do 3 to 5 breaths again.
So I'm supposed to be leaning back?
Yeah, this is your pivot point, right where your thumbs are. Very good. Okay. Good. Awesome. So that's general muscles around the spine as well as the back of the legs, very common ones. I'm going to grab a chair. I'll be right back. Now this one I want you to be careful of, and I'll tell you this straight up, that most people with chronic back problems that come in that had this for years, they have balance problems. Some of them don't even know. So when we get into our second and third phases of our restore protocol, we're challenging their balance because we want them to have that balance restored. Because people come to me and they've got back pain that they've been over and picked something up, and all of a sudden they can't move and they can't sleep, and they think that's their problem. That's just the most recent symptom. So in evaluation, our goal is to not only get them out of pain quickly, right? But we also want to strengthen, stabilize, improve their range of motion to where this isn't coming back over and over again. In addition to that, when we're looking at balance, and we see, because we test people's balance, and we see how deficient their balance is, that's dangerous. That's people falling in the bathtub or the shower or wherever, breaking a hip. So when somebody comes to see us and their back hurts, we obviously want to help them through that. But we're thinking so far down the line, because I've been doing this so long, working with so many people, that I don't want them to fall, break a hip, right? So that's part of the reason that we're doing this. Now, you ready for a challenge? Okay. So this one here, we're going to stretch the quadriceps muscle. This is one of the hardest ones for people to get because it's tight, it's hard to stretch, it requires strength of the opposite leg. It's not the most fun, and you got to really focus on the form. So Carolyn, what I want you to do is face that way and put the top of your foot on that chair. So you're going to be facing me. And don't fall. Rule number 1 on opposites, do not fall. We're going to square up your hips. Sure. There you go. Perfect. Now, you got it? Okay. So I'm going to have you hold your arm maybe up here, okay? Do you guys see this bend right here? Remember I said we're all cheaters? Well, as nice as she is, Carolyn's not an exception here. So what that does is that takes the stretch out of the quadriceps, right? So here's what we're going to do. We're going to straighten that leg up.
Ouch.
With that leg straightened, remember, we're going to fall. She's going to take a deep breath in through her nose. She's going to gently and slowly start bending the right knee without changing the thing. You can do that. Good. Okay. All right. Now, I'm going to let her come up because this is hard, guys. Is that hard?
Yeah.
Yeah. So you can go ahead and stand up and get one more stretch on my shoulder. Go ahead, both go for it. So now you know how to stretch the muscles of the back, you know how to breathe properly, you know how to relax properly. You know how to stretch the muscles in the front of the back of the legs. We're going to stretch one muscle right now that I promise you, if you pay attention to this, and if you can do this, it can change your life forever, because I see this all the time. I see people who come to me with sciatica. I'll say sciatica. Anybody here ever had sciatica before? How much fun is it? No. It's absolutely terrible, right? Okay, well, I can tell you it's one of the most commonly misdiagnosed skeletal issues there is. I have seen people have unnecessary surgeries, shots, and everything, and they never get any better. A lot of times they'll get worse because of this one muscle. Everybody ready? This muscle is called your piriformis. Your piriformis is an external rotator of the hip, goes right across your buttocks, right across the sciatic nerve. So if you've ever had the type of sciatic pain that's worse when you're sitting, feels like you're sitting on a hot poker and you can't get comfortable, there's a good chance this is what it is. So I'm gonna teach you how to stretch it, so this is where we go. Okay? So I'm gonna have you lay on the floor with your feet this way, your head that way, the bottom's gonna be right in the middle. If you cannot see and you want to come around to where you can see, feel free, okay? Okay, very good. So, what we're going to do, we're just gonna pick a side. Remember, if you stretch one side, you gotta stretch the other side. I'll give everybody a couple minutes here.
I have a question.
Yes.
The last one,
Uh-huh.
it would be okay to do it so that you're close enough to put your hand like on the back. of the
Absolutely.
pocket.
Yes, thank you. Actually, Carol made a very good point. Remember, rule number one is do not fall, right? So don't go put yourself in a position with one of these stretches where you'll fall and hurt yourself. A lot of times, you know, we have to start out very gingerly with people because we don't want them to be hurt. So do find a way to be able to balance safely. You might be able to back yourself into a, well, let's see, face yourself into a corner of your room, a corner of the room. That way if you fall, you're not falling very far, right? All right. Oh, wow. Maybe it'll come to me. Okay, very good. So now we're going to stretch the piriformis. Remember, the piriformis goes right across the buttocks, and it is an external rotate of the hip. So what we're going to do is we're going to take Carolyn's left leg here, and we're going to raise it up, knee like so. You can do this on your bed, because some of you might not be able to get down on the floor and get up. Right? I hear that all the time. It's okay. You can do this on your bed, but rule number one still applies. Don't fall off the bed. Right? Now, we're going to take her other leg. We're going to take it up here. We're going to bend her knee. We're going to lay it down over here. Oh, Lord. You're a good example.
That's hard.
Okay, we want to keep her leg low like this. We want her ankle to be just outside her knee to where we're not putting pressure on the ankle. And what Carolyn's going to do is she's going to reach and grab her thigh with her outside hand like so. She's going to take her inside hand and come around and grab on the inside. And then I'm going to help you a little bit here, okay? She's going to pull to where she about can't stand anymore. She feeling it? Okay? She's going to take a deep breath in through the nose. She's going to blow it out through the mouth. Good. See that extra stretch? In through the nose and out through the mouth. Good. One more. And good. Okay? Now, just for good measure, let's do the other side. And then I think I've got one more stretch and then that's it. So let this, are you going to go this leg? Grab this leg here. Yeah. So then you're going to pull back towards you. Good. Good. So you're going to take a deep breath in, blow it out, pull. I'm going to throw a little bonus in here on this spot.
Do what?
I'm going to throw in here a little bonus that I just thought. Okay, very good. So I'm going to show you something here. It's going to be a little bit different, and then we're going to do one more stretch. One thing we see in the office very, very regularly is people actually do not know how to get up off their back properly, and they're actually doing damage. So here's what you do. If you're laying even in bed, okay, you're going to roll over on your side. So pick a side. Doesn't matter. And you're going to make a fist with your top hand, so it'll be your right hand. You're going to stick the fist directly in the bed, the bench, the floor, whatever you're in. And then if you can picture her being in bed or on a bench, as she pushes herself up with her right hand, she would be swinging her legs off to fall off the bed. Now, just stay just like that, because you actually just moved into the next one. Everybody understand that? It's hard to show. Okay? Last stretch you're going to do is called cat-cow. Oh, no, 2 stretches. One more here. This is a yoga pose called child's pose. You don't have to call it yoga, it's just a stretching. So what we're going to do here to stretch the back muscles here, deep breath in through the nose, Carolyn. And then she's going to blow it out and let her bottom fall all the way back as far as it can. You good? And you should be able to get your bottom to your feet. Now she's already doing the breathing. You're a fast learner. Good. Now when you get your bottom to your feet, that doesn't mean the stretching's over. That just means it's as far as your bottom will go. So what we'll do here is we're going to take a deep breath in through the nose, leave your bottom here, walk your fingers away from you. Good job. Can you feel stretching? Yep. Absolutely. Cool. Very good. Okay, so that would be the child's pose one. And then we would do 35 breaths with that as well. And now we're on to the last one. So come back to hands and feet like you were. So with this one right here, we're going, it's kind of like a cool down, relaxation, flexibility exercise for the back. The very first one, we're gonna want her to arch her back and want her to pretend that there's a string pulling her straight up. And she's breathing in through her nose and out through the mouth. The string pulls up just a little bit more each time. Good. Is that your third breath? Perfect. Now we're gonna go the opposite way. And we're just gonna pretend that Carolyn really, really, really likes beer. And so what she's gonna do is focus on giving us, you're welcome, by the way, giving us the biggest beer belly she can. Now, with your shirt, nobody can even see it. She's doing exactly right, okay? Good. Perfect. And then she's gonna do the same thing, okay? Very good. So 3 to 5 breaths on that as well. And I'll tell you this, as you go through the stretching, some of these are going to be easier for you than others, some are going to be harder than others. What does that tell you? It tells you spend more time on the ones that are harder for you. Fair enough? Okay, very good. Now you can get up or you can get in. I can get in. It's fun. Let's all get ready. Yeah, absolutely. You're exactly right. Okay, we are wrapping up here. I've got just a couple more things for you. Just a couple more things for you. Unfortunately, I'm going to make a lot of it really fast, but it's for good reason. So let's take a survey, real quick survey, by show of hands. When your back hurts, the best thing to do is sit on a heating pad. Get the heat on there. Oh, yeah, I love you guys. What do you do instead? Yay. Very good. Anybody know how long? Yeah, no more than 20 minutes, no less than 15 or 20 is very good. Even the doctors tell me. Outstanding. You would want to use ice, like if you, let's say you don't listen to a word I say, and you jump right into the garden the first nice spring day, and you overdo it about getting me the next day. If you go lay on a heating pad, you will feel good while you're on a heating pad. Lay on it right before bed so you can go to sleep, right? And then you about can't move in the morning. It's really good at increasing circulation, which in turn increases inflammation, right? So you can do yourself much more good by putting ice on the area for like 20 minutes. You can do 3 to 5 times. Protect yourself if you got one, especially one of those good gel packs, those blue gel packs. Wrap it in a somewhat thin towel. Keep it under your skin because you do not want it to burn. Okay, very good. All right, so yes.
The best day when I exercise my muscles and I'm tired is when I walk the dogs in the evening. It loosens me back.
There you go. Hey, movement is life. Movement is absolutely life. I mean, so many people, they're busy all their lives, and then they retire and they sit, and then life goes away. Okay. I'm going to go ahead and send this around again, just in case you didn't get it. And there's another one over here. These are our social medias. Does anybody need to know how to use a QR code? Because I'll happy to tell you. Okay, so everybody knows how to use a QR code, so I'll let you pass that around again real quick, just zigzag all the way back. If you want entertainment and funny, go for the TikTok and the Instagram. If you want information, things that are going to help you, interaction, go for YouTube and Facebook. If you have your own business or part of a business and you're looking for, maybe you want a massage event in your business, maybe you want fit while you sit, how to keep from injuring your back, whatever it is, I mean lots of different talks. Then get the LinkedIn one because that's our business to business. But you can reach either one. I told you our phone number is 405-340-4400. It's on the business card. You can call or text there. I about forgot to ask. Good job on the posture evaluation. Who had perfect posture? Who had perfect posture? Nobody did. So I'll see you all wrong, right? Very good. Oh, and I forgot to state this. Another thing to do for you, so you got the stretching, and by the way, do this for the next 30 days. And I'm gonna leave some things, well, I'm not gonna leave them, I'm gonna let you guys fill this out if you want. If you'll follow us on Facebook, YouTube, stuff like that, and if you want more information, we've got a stress survey here that you can fill out nice and easy and fun, fast. But anyway, you can't start strengthening muscles until you've stretched the tight muscles out, okay? So that's why I didn't give you any strengthening advice today, but I do want to share that with you in about 30 days. So who all can commit to doing the stretches for the next 30 days? 3 of you, thank you. Okay. All right, good. So what Melissa and I are going to do in our office is we are going to make a video just for you that is going to show you what to do to start strengthening. So now we're at the first part of February, then we get into the first part of March, then by the first part of April, when we're starting to get serious about gardening, we're in much better shape. We're also going to throw in some bonus on what to do to improve your balance. One good example, we had an elderly woman come in last year sometime, and she had bad balance trouble. So much so that when we had her start just the basic level of balance, she had to stand sideways to a wall with a staff member like this because she would fall. A couple weeks go by, and she comes back in, or 2 weeks go by, and she comes back and she says, I want you to know I haven't fallen in 2 weeks. And we're like, oh, cool. She says, no, I was falling twice a day. That's dangerous, guys. You don't want that, right? Okay, so another thing, if you've been to a chiropractor before, you've got a chiropractor you like, maybe it's been a while, maybe you're not on a good schedule. I can tell you this, what the research shows is that once you're to a maintenance point of view, you want to get that spine checked and corrected every 4 weeks, right? Because if not, discs are dehydrating, muscles are shortening, muscles are weakening, right? Bone spurs are starting, there's a layer of scar tissue laid down about every 4 weeks. Very cheap insurance to ensure a very good, pain-free gardening career. So, if you have that chiropractor you haven't seen in a while, you call him, you text him, you email him, whatever, and you say, so this crazy bald-headed chiropractor talked to us and told me I need to get back in and see. Take care of your spine. Remember, I said earlier that most people take better care of their heart that they train every 3 years than they do with their actual spine that they get one time. Okay, very good, very good, very good. All right, so I have a gift for 5 people in here, and well, I have a gift for all of you, but 5 of you get a very special one. This is all we got. I have 5 different appointments here that are for a back pain-free gardening season severity assessment. Okay? So what we do there is we'll do your specific posture evaluation, balance, bilateral weight scales, and a consultation. All it is to see if you have something that we're good at helping. And if you do, then we'll talk about what needs to be done at that time. But it's just a free opportunity to come and check things out. If you would like to, there are 5 of these. Where's a good place to do it? Over here? Can I move things around here? Okay. And there's a social media thing right there as well. So what I'm gonna do, I'm gonna put these with the appointment times in order, if you want them. Once they're gone, that's all I got. Yes, I even know the word. And then, if you'd rather just be on our mailing list to get our monthly e-newsletter, which includes, fun recipes, how to reduce inflammation, stretching. We mix it up to where there's a little bit, it's not very long, it's just a quick email. If you want to do that, I have stress surveys here that you can fill out. They're very brief to fill out. We do not sell your information. People would allow us to do that if we wanted to. Okay? And we're not going to bombard you. It's just a way of sharing information. Okay? So, real quick. If anybody wants to do one of these, just raise your hand and I'll hand it out to you and we'll get you on the mailing list. Very good. And while I'm doing this, are there any questions?
How do you feel about equestrians?
I think riding horses is pretty cool.
Do it every day.
Good, yeah. I'm sure you have good form. I'm sure you have good form.
My trainer says I do.
Yeah, well, there you go. Yeah, absolutely. Just don't fall off. I wouldn't go along with that.
I practiced that years ago.
Okay. You got the fall spelling off down right?
Yeah, I got it
Okay,
down.
very good. Anybody else? We got three more.
I really want to. This one.
All right, any more questions? We'll wrap it up.
I thought he said you too. I think I have three.
Dr. Carter, make sure you have them flip it over and write their information.
Oh,
on
yes,
that.
thank you.
That's
So
how
on
you'll
the
get
cards over here, you'll see the appointment time. You can flip it over. There's a place for name, phone number, and email, so we can contact you if you're wanting one of the appointment times. And then we'll write that on a business card for you so you know what it is. We'll keep that actual card. Any other questions? How many of you are already gardening, like in a greenhouse or something? Oh, very good. Starting all your own seeds.